Now we start trying to bring it all together as we talk about neurotransmitters and brain circuitry and depression and medications used to treat depression. The neurotransmitters all have their circuits or their tracks, as Stahl has told us, and they influence both the positive and the negative affects that we have. Reduced positive affect is usually a malfunction somehow of the dopamine and the norepinephrine systems. And when we have reduced positive affect, that means there is less joy, less enthusiasm, less energy, less pleasure in life, less alertness, less cognitive functioning and sharpness. And when we have increased negative affect, which is often a malfunction of the serotonin and the norepinephrine neurotransmitters, that increased negative affect is more feeling of guilt and hostility and irritability, fear and anxiety. These are emotions that all of us have, both the positive and the negative. But in depression, we have a hypofunctioning of the positive affect and maybe an increased functioning of the negative affects. But in mania, we have a hyper functioning of the positive affects. And we actually sometimes can have a very increased negative affect as well in bipolarity. Now, I want to see if I can pull this up for you very quickly. In Stahl, I really find that on page 499 in figure 1155, this one over here is an excellent little chart to help you see in a quick glance how all of this stuff begins to come together when we are talking about neurotransmitters, brain circuits, and the medications that we're going to use to affect these neurotransmitters. Remember, though, it's not that simple a theory that all we have to do is restore a chemical balance. We are looking often at a much more long-term process in the neurobiology and neurochemistry of the brain that eventually it can be actually affecting the anatomy of the brain, the neuron structures. So lots of information coming our way right now. Let's move on to the next slide.